any kind of cancer is awful, but in this video, we discuss the deadliest of them all. 1. Pancreatic cancer. Pancreatic cancer begins in the tissues of the pancreas, which aids digestion. Digestive system cancers in general are quite deadly, with fewer than half of patients surviving 5 years, according to SEER data, and pancreatic cancer is the deadliest of the bunch. 2. Mesothelioma. The mesothelium is a layer of cells that line certain cavities of the body and surround the internal organs, according to the ACS. Mesothelioma is a cancer of these cells. 3 out of 4 mesotheliomas develop in the mesothelium that surrounds the lungs, which is called the pleura. This type of cancer is called pleural mesothelioma. 3. Gallbladder cancer. This digestive system cancer begins in the gallbladder. The gallbladder, located underneath the liver, concentrates and stores bile, which is a substance made by the liver that aids in digestion. Gallstones, which are small, hard deposits of cholesterol and other materials in the gallbladder, significantly increase the risk of developing gallbladder cancer. 4. Esophageal cancer. The esophagus is the muscular tube that transports food from the throat into the stomach. Risk factors for esophageal cancer include older age, being male, smoking, drinking alcohol, and having acid reflux, in which stomach acid comes up into the lower esophagus. 5. Liver and intrahepatic bile duct cancer. The most significant risk factor for liver cancer is chronic hepatitis B or hepatitis C infections. Both of these infections are transmitted through bodily fluids, including blood and semen. The CDC recommends that all children be vaccinated against hepatitis B virus, but there is no vaccine for hepatitis C. 6. Lung and bronchial cancer. Lung and bronchial cancer kill the most people worldwide and in the US every year. Smoking and use of tobacco products are the major causes of it. There are 2 major types: non-small cell lung cancer, which is the most common, and small cell lung cancer, which spreads more quickly. The best thing patients who smoke can do to prepare for treatment is to quit smoking. 7. Pleural cancer. Pleural cancer occurs in the pleural cavity, the space within the chest cavity but outside the lungs, or in the layer of cells that surrounds the lungs. The NCI includes pleural mesothelioma in the mesothelioma category for purposes of monitoring survival, so cases of pleural mesothelioma aren't included in pleural cancer statistics, according to Kathy Cronin, a scientist with the surveillance research program at the NCI. 8. Acute monocytic leukemia. Acute monocytic leukemia is a subtype of a type of leukemia called acute myeloid leukemia. It develops in blood precursor cells that are on their way to becoming immune system cells called monocytes, explained Laura Romanstadt, a registered nurse who helps patients find clinical trials as a clinical trial nurse navigator with the Leukemia and Lymphoma Society. 9. Brain cancer. In adults, brain tumors rarely begin in the brain. More often, they spread there from other cancers. But brain cancers that are caused by cancers that originated somewhere else in the body aren't included in brain cancer survival statistics, because cancers are categorized according to their site of origin. 10. Acute myeloid leukemia. Leukemias develop from stem cells in the bone marrow, which differentiate into different blood cell precursors and eventually blood cells. Leukemia occurs when blood cell development is halted and the cells become cancerous, explained Romanstadt. Leukemias are classified according to the stage at which blood cells and precursors halt their development and become cancerous, Romanstadt said. Just because there are effective treatments for a particular cancer doesn't mean that the treatment will work for everyone. Each person's cancer has a unique molecular signature and responds differently to treatment compared to someone else with the same type of cancer, Rebecca Siegel said. And that's a wrap. We'd appreciate seeing your feedback on our videos, so go ahead and type them on the comments section below. Thanks again for watching. Stay healthy.